Hello, you beautiful humans. This is your host, Karen Davis King, and today I am with a very special guest, my dear friend and spiritual badass, Mary Histing. Welcome to the show, Mary.
Thank you for having me, Karen.
I am so looking forward to this. So, Mary and I have collaborated on some things in the past before. Mary is a craniosacral therapist. She's been doing craniosacral therapy, or we could call it CST for short. For some of you like me who have a hard time enunciating that, she's been doing CST for, I think, about 14 years. So, I have personally experienced her expertise, and I wanted to have her on the show because this series is about mental health. And it is really important to me that people out there, our listeners, our professional humans out there who really want to embrace the human experience and not be afraid of their emotions and really just embrace the good, the bad, the ugly, all of that stuff, because we live more passionately, more vibrantly when we're able to do this. I want people to know what is available to them in terms of taking care of your own mental health, your mind, your body, and your spirit. And I know the power of this, and I've only experienced, a tiny bit. I've had a few sessions here and there. I know people who've been impacted by it greatly. And I just discovered I was having a conversation with Mary when I was in town visiting. By the way, I heard it's 18 degrees there or something like that today.
It's gonna get up to 30, so it's warming up.
Okay, it's getting warmer there in Virginia. It's about 70 here. So I'm happy where I'm at right now. Um, what was I saying? Um, I want people to know what's available to them because often we go to the doctor about something, they don't ask us anything about our lifestyle. They don't ask, have you gone through something traumatic lately, or something where you might be grieving, something very stressful like a move, a divorce, the death of a loved one, a breakup. They don't ask it, what have you been eating? Our diet and our lifestyle and what's happening in our lives can wreak havoc on our physical health. And then that in turn, it's just this cycle with mental, physical, spiritual. And so if people knew and understood more of, rather than having someone just write them a prescription, treat the symptom instead of the root cause, if people knew that they had more options other than just going to a doctor and saying, yes, you have low back pain, here's a muscle relaxer, have a good day, fuck off. Like I there's more out there, folks, and I want you to know this. And as we were having this conversation when I was in town, I discovered that you can do this remotely,
Mhm.
which blows my mind, but yet it makes sense for any of you out there who understand energy. And Mary, you can share more about how and why this works remotely as well. It actually makes a lot of sense why it would work remotely as well. So I'm going to shut up now so I can let you take the floor, Mary, and and just tell us more about what craniosacral therapy is, how it works, and why it's so good for our mental health and healing process.
Excellent. Thank you, Karen. This is my favorite topic to talk about. You may have to cut me off after 2 hours. So I've been a craniosacral therapist for about 15 years now. I discovered it after massage school. I finished massage school in 2010, and I had this burning question: how do we get to the emotional component of things? Because I realized that people were coming, I was seeing people in my practice and my work that I would ask them, okay, so you've got this issue with your back, your leg, your arm, your whatever. What happened when this started? What was going on in your life? And nine times out of 10, they would say, well, it was after my kids grew up and left I was an empty nester. So I had an empty house. It was after I moved, from downsized from one house to another. It was after my divorce. It was after my dad died. There was always an emotional component to people's physical issues. And I had this burning desire, like you said about the root cause. I want to get to the root cause. It's no good if I'm just moving muscles around. I want to get to the root cause. So I discovered craniosacral therapy through the Upledger Institute, which is based in Florida, believe it or not, in Palm Beach Gardens,
Oh,
Florida. That's their headquarters, but they're international as well. Just a quick explanation. Craniosacral therapy was a therapy developed by Dr. John Upledger. He was an osteopath who was working in, I believe it was in Michigan, around the late 70s, early 80s timeframe at a teaching hospital. And he was, doing his osteopathy and, working in the hospital. And there was one particular story that's always stuck with me. He was assisting a surgery of a patient, and the doctor he was working with was wanted to isolate the tissues of the spinal cord. And so he asked Dr. Upledger, can you hold the tissue of this dural tube that covers the spinal cord? Can you hold this still for me as we're working? And he couldn't hold it still because it was moving. And he started to have questions of why is it moving? What's it moving for? How's that happening? And discovered the craniosacral system, dove deeper into that. The work of Dr. William Sutherland in the 1800s discovered that the cerebral spinal fluid in the brain, the spinal cord, there's movement in that system. And as that system is moving, everything in the body moves with that system, and it's separate from the cardiovascular system. It has its rhythm of movement is 6 to 12 cycles per minute. So Dr. Upledger started really focusing on this system in the body, and he started noticing that you could affect the system if you touch the body with the lightest possible touch, no more than 5 grams of pressure. And he started, working on patients that were coming his way. And before you know it, colleagues would send him their impossible cases, kids that would never walk again, or people with, traumatic brain injury or whatever it would be. And people started getting better. And it was incredible. And before you know it, the colleagues from all over the world coming to ask him, what are you doing? What are you doing? What are you doing? So
wow.
fast, he started teaching craniosacral therapy because people were asking, what is this? How does it work? And incredible human being. He developed a whole curriculum and wrote many books and collaborated with colleagues in different disciplines. And
Wow.
he's been passed now probably about 10 years or so. And his work is still spreading all over the world. It's incredible. And so when I took my first class, I fell madly in love.
I can see why. I mean, it's fascinating and creepy. It's so
Mm,
fascinating, it's creepy.
mhm,
All the and just yet the more proof of how connected everything is.
mhm.
Our
Right,
body is just one ecosystem
right.
within another ecosystem, another like Whoville.
Exactly. It's all so intricately interconnected. You can't, like I said, the emotional affects the physical, and you said as well, the physical affects the energetic, affects the spiritual. It all is interwoven intricately, and you can't pull them apart. So when if you've got an issue, like let's go to the depths of it. And sometimes the depths are right in that craniosacral system. It would have to do with the connective tissue that covers the nerves and the nervous system. So that's the dural system, it's called. And it's similar to fascia. It interlocks with the fascial system, but it would
Mhm.
be all the coverings of the brain and the spinal cord. And with the lightest possible touch, we're actually able to affect that system. And it is almost miraculous. The first class I took, I was blown away because the biggest task is to learn to feel the rhythm with your hands, and it's so subtle. And I was getting frustrated and thought, I can't feel the rhythm. I can't feel it. I can't feel it. I had my hands on a student, and
Uh-huh.
a teaching assistant walked around and said, well, what do you think you feel? And I said, I think I feel a little bit of movement. She's like, well, then you feel it. If you think you feel it, you feel it. And that just unlocked this whole odyssey in me. Now, it's spread and spread and spread. And after all these years, I've worked with clients with every possible diagnosis you could think of. When somebody finds me and says, well, I've been to Johns Hopkins and I've been to 12 doctors and I've been here and I've been there and no, nothing has ever shifted this. And I say to them, you came to the right place because this is the
Yeah.
therapy that goes places that nobody else will go. I can work deep inside the brain. I could work deep inside the spinal cord. I can work anywhere.
Right, right. You can get to it. I want to go
Mm-hmm.
back to what you said about when you took your first class and the feeling like that frustration of I can't feel anything. I don't know what's that's really important. And then I love what your instructor, how, they remedied that for you and kind of gave you a picture. We're looking for something like this big, grand experience, right? And we often overthink it over, um, we just, we over glamorize it or whatever,
Mm-hmm.
but it's really actually can be very simple. And I know
Mm-hmm.
even just in teaching practices when I was Mary and I both used to teach these tantric, and we taught workshops on some tantric principles, intimacy, relationships, conscious relating kind of stuff. And I loved doing that with you. We came from very
Mm-hmm.
different backgrounds, and we're going to be doing another in the next series. We're going to have another series around February in on relationships. And so I won't say too much now about that, but we do have a lot of background collaborating on things like that. But back in my what seemed like a lifetime ago when I was doing coaching on sex, love, and relationships and intimacy, and a lot of times I would teach a practice and I would, try to get them to drop in their body. And I'm saying this for our listeners because if you are someone who feels like when someone says, where do you feel that anger? You talked about feeling anger. Where do you feel it in your body? Well, I don't know where I feel it. And I would say, take a guess. If you don't know, that's okay, right? But just guess. And wherever they're guessing is usually that's where it
Mm-hmm.
tends to be. And then
Mm-hmm.
you take your focus on that. But we're not taught to be present of what's going on in our body and where our
Mm-hmm.
emotions live. And, but there are massive correlations and there's science to it, y'all.
Mm-hmm.
So I appreciate you saying that. And I just wanted to point that out for our listeners that if you think you can't feel energy, because I feel like that sometimes when I was doing Reiki healing and stuff, sometimes I'd feel like I don't know, but you just sit and be present with it. It won't always be some big, great grand experience or something that you know for sure without any question, right? Because it requires you to just keep being present and practice, whether it's with yourself or a client or a practitioner or something like that. So just trusting yourself is really important. So I just needed to say that for our audience because I know there's a lot of people who get very frustrated with not being able or thinking like somebody could walk away thinking, I'm not going to be good at this or it's a bunch of hocus pocus because I didn't feel anything that, was explained to me or whatever. But it's
Mm-hmm.
there. We just have to practice it and learn to be present.
Yeah,
Yeah.
yeah, and be open. That's a big part of it too.
Yes.
The
Yeah.
people I've met over the years, there've been maybe only one or two people that I felt like, or they felt they couldn't receive any help at all from what I do. And what they had in common was they were completely closed mentally to it. They didn't believe it could help. They didn't believe in it. They didn't believe anything they couldn't see or couldn't put in a box or, and this one particular individual I remember, she was very, nitpicking, like, when am I going to feel better? When am I going to feel better? I need to know when I'm going to feel better. And
Um,
I said, honey, what is it that you want to do? And she said, I want to get on the elliptical. I just want to start working out again. I said, please go do that. If just do what you feel called to do or what you feel a pull to do. I'm not going to force anyone to do anything, but she was really just could not open her mind to it. That's really the secret. We have to be open.
thank you for saying that because yes, we can. whether it's our physical health or something else, not finding a partner or, financial stuff, we're the ones who get in our own way, and we benefit sometimes from being broke or being alone or being sick. And
Mhm.
it sounds crazy to think, that a person, no one's really actively, consciously choosing to be sick, but there could be things going on deep within our internal system that are, like you said, are keeping us closed off from receiving the healing. And
Mhm.
so we are not allowing it in. So being open is really important because we can look to somebody else. I want you to heal me, but we are actually the ones healing ourselves. We
Mhm.
are, like, your role is vital. You're like the guide, but that individual is the one who's going to either receive or not receive the healing.
Yeah. And that's actually leads me to my favorite thing about craniosacral therapy is that it doesn't come from me. It doesn't come from my brain. It doesn't come from me at all. I put my hands on a person and their body will do the rest. And it's like being taken on this grand adventure. My hands are shown where to go, where the body's ready to shift and move, and I
Mhm.
will just follow along. And at the end, the person's like, "How did you know where to go?" I'm like, "Your body showed me." It's so exciting for me that it's not me at all. It's just me following along. And if anything that I come to do is to build a trust with the body, and to really assure the body, like, hey, I'm here to just trust you and follow your process and observe whatever it is that you want to do. That's what I'm here to do. I'm not gonna bring ideas of, how you should get better or what it should look like. I'm just gonna show up and follow what you do. And that's the magic right there.
I love it. Well, that sounds like a dance to me.
Yes.
That sounds like a dance for sure. And it's a beautiful dance.
Mhm.
And so I'm fascinated with how this works remotely.
Mhm.
Talked about this a little bit, and I would love for you to share with the audience how something like this can work remotely if someone wanted to do some Zoom sessions with you.
Yeah, yeah. It's one of those things that you're mentally you're like, I don't get it. I'm not sure 100% get it mentally, but I know it works because I've done it so many times. So when I work with someone remotely, and it's happened actually. I usually would work with people that I've seen them in person, and then we decide to work remotely. But I have had a client that we've never met in person, and we worked remotely. And we always begin with a face-to-face meeting like this on Zoom or Google Meet or some sort of FaceTime, whatever. We start with this, and as we're talking, I'm just kind of starting to already pick up their energy as we're talking. And that,
Mhm.
it's like an energetic connection is established. And then after a few minutes, I'd say, "Is there anything else you need to say before we get started?" And if like, "No, that's complete," then I'll invite them to lay down at their home, and I put them energetically on my table in my office. Um, and what happens next is as if they were in the room. I put my hands on their feet energetically, and I tune into their cranial sacral system, and I can feel, oh, okay, there's a pull up the right leg, and oh, there's something on the left shoulder, and okay, it's up in the jaw, and I can feel it as if they were in the room. And then I put my hands there as if they were there, and I follow the body's processes. And at the end of the session, after we've done the entire session, we'll reconnect again on video like we are, and I'll just ask, how was that for you? And a lot of times people will say, oh wow, I got so deeply relaxed that I think I checked out. I think I might have dozed off. And I might say, how is that, issue that you were feeling before? And they're like, oh, I don't feel it anymore. Okay, that's interesting. And then I'll report what I discovered. I'm like, okay, so I found this in your hip, and that was in the knee, and that was in the shoulder, and there's something up here in the cranium, um, and it always blows me away.
Yeah,
Actually,
right.
I worked with a client the other day. She's out of state. She's in a completely different state. And the coolest thing happened. Like her body really gave me the name of where I was working. I was working on her cranium, and I had my hands over her left eye. And all of a sudden, I heard the name of the structure. I heard um, the cribriform plate, and I was like, "Oh my gosh, where's the
Wow.
cribiform plate? So I got out my trusty skull. This is Clark, my teaching skull. Say hi to Clark.
What's up, Clark?
It's Clark. And so I took his head off because I want to see what's inside there. And I found the cribiform plate is like right here. It's this little bony ridge right here.
Hmm.
And it's right, it's where the olfactory nerves are located. And it's a very important part of, it's near the eye socket, but part of anyhow. And then the fox cerebri attaches there, these membranes. It was fascinating, but her body just told me the name of where I was working. And
That's
yeah,
crazy.
after the session, I told her what had happened, and she said, "Oh, so that issue I've been having with my eye, when it bothers me, I always lose my sense of smell." And I said, "Well, there you go." So it
Wow.
was cool. It was cool. That happens all the time.
Yeah, that is wild.
Yeah. Yeah.
Yeah, and
So.
that you were like, you heard that, and then we're like, where is that exactly? And then,
hmm
had to, wow.
Right, right. It's cool. And other stories have happened where I worked on a lady remotely, and I was working on her head, and this is like a crossover into, the other energy work that I do. I got an image of a German Shepherd dog and
Uh-huh.
a cowboy hat. And I kept seeing this image over and over again, a German Shepherd dog and a cowboy hat. And so after the session, I asked her, I said, I don't know why I'm seeing a German Shepherd dog and a cowboy hat when I was like, working on your head. And she said, oh, when I was like 7 or 8 years old, I was attacked by a German Shepherd. And when I was a kid, I used to wear cowboy hats a lot. I went, what?
Oh my
Isn't that
gosh.
crazy? And so her body was holding that memory. I mean, literally, her body was holding the memory, and it was unlocked as I was working.
Wow. Well,
Hmm
I remember having an experience with you when I was on your table. This was, I don't know, maybe 5 years ago or something. And I was struggling with some stuff. And I can remember I was having some physical stuff and everything. But you had mentioned something that seemed completely random and out of left field, but it meant something to me
mm
about dolphins. You got an
mm.
image of dolphins. I don't even know if you'd remember this,
No.
but it was so funny because around that time, I I was kept getting these signs like I've had a hard time receiving support, and a lot of the stuff I was dealing with was stuff in my root chakra, which is
mm
all about feeling safe and secure in the world, financial stuff, and it all made sense that all of that root chakra stuff that I would be having the pain and limitation that I was having.
mm
Um, but I was also having trouble allowing people to support me and believing
mm
that I'm not supported, but I'm the one
mm
who's not allowing the support because I was making
mm
myself believe it's going to cost me more than it would be worth. There's always some
mm
cost if somebody helps me with anything, and I don't want
mm
to feel more vulnerable or pay for the thing, whatever the support is. It could just be somebody, just the littlest thing, and I don't want to. And so when you brought up the thing about the dolphins, I had been having all these little experiences with dolphins. And this
mm
whole thing, you had no idea about that either. But it was just this image that came to your mind about me being in the water, this rough water, and these dolphins were all around me just
mm
like supporting me as dolphins do. You hear all these great stories about dolphins, and it's so funny because yeah, I was just blown away. I remember being in tears just feeling the
mm
truth of that. Like I was surrounded by nothing but support on the other side, spiritually, and just all around me, people who love me, but I just wasn't allowing that in. And you painted that picture for me that came to your mind based on
mm.
just what you were picking up from me. And
Right.
it was such I never forgot it clearly because it
mm
was such a vital, and dolphins have become very special to me
mm.
because that image is ingrained in my mind, that reminder. And now that I live by the beach,
Yeah.
see dolphins often, but I know
mm
they're there, you know,
Right.
and I'm always interacting with the beach and the water and everything. And
Mhm.
and that's one of the places in nature where I feel the most supported. I go down there, I dance with the water, and it's just this beautiful, beautiful thing that like
Mhm.
every time I leave, I'm saying thank you and I love you. I feel like the ocean is happy to see me. And it's just something that reminds me how supported I am in every way. I just have
Mhm.
to stay open to it, as you were
Yeah,
saying.
yeah,
Yeah,
it's
yeah,
awesome.
yeah.
Awesome.
Yeah. So it's wild how are open,
Mhm.
you're this conduit, and that your client's body is telling you things, and you're picking up on it and relaying it back to them, basically.
Yeah. It's very humbling, and I feel so privileged to be there. And so many times I'm saying to the body, thank you for trusting me, thank you for opening to me. Yeah, it's incredible. And there have been times when I've worked with people's bodies who've been through a lot, like a lot of dental procedures or a lot of surgeries or a lot of, interventions of some sort. And
Mm,
I always ask permission, like, am I permitted to touch you here? And the body sometimes says no. I had a
mm,
client once that it was probably 2 years before I could work on this particular area because she'd had injections and surgeries and all kinds of things, and she was always in pain there. And then finally, one day, the body said, "Go ahead." It was, yeah. So I need to really just respect the body. That's my job, and it's amazing what happens when I do.
Well, and that's also it's also a reflection on your client. And it's a reminder, again, for listeners and anyone who's interested in this type of work, that again, it's important that we stay open. How many people might say, I've been doing this for this amount of time, and sometimes it just takes time for us to open up and be willing to receive the support, to receive the healing.
Mhm.
And I'll never forget this. I remember when I was taking the training for mind body nutrition with Mark David. Because again, we look to healers and practitioners and doctors to fix us, and we're the only ones who can heal ourselves. But the our Western society often puts this pressure or the glory on the doctor to kind of play God and be the fixer, and I know better than you. Right. And this
Mhm.
is why another reason why I love doing podcasts like this and giving people an option, because it puts the power in the client's hands. But that practitioner is vital to opening the client up to knowing they actually have the power
Mhm.
and being
Mhm.
that conduit to opening that up. But there was something
Mhm.
else I was going to say about that. Oh no, I don't want to lose it. Um, mm, damn. I think I lost it, but if it comes back, but
Mhm.
it really is just about being able to stay open to the fact that I am my greatest healer. And
Yes.
that sometimes I need other people's skill, expertise, support in order to help me get there. But I
Mhm.
am still the one with the power to heal. Oh, I know what it was. Mark David. He had said sometimes, because it can be easy for us as practitioners of any kind to start to get in this space. Oh, I want to help them. I want to help them. Oh, they have so many issues, and I just want to be able to help them. And if they're not willing, we don't have any control over that. And this pressure to heal them and fix them. But he said something I'll never forget. He said, sometimes the healing comes in not being healed, even if it
Whoa.
comes through someone passing on to the other side. Maybe
Mhm.
that is the healing they actually were seeking,
Yeah.
to learn how to surrender to the beauty of a death.
Yeah.
And I
Yeah.
was just like, whoa.
Yeah.
I never thought of it that way, because we always see, and I mean that's not something people like to talk about, but we always see the healing and the big win as oh, I got past this thing.
Right,
But sometimes that thing can take us somewhere else and that
right.
we didn't intend to go, but that maybe that's where our soul was taking us.
Right. And we never know where we're meeting a client on their soul's plan, their trajectory. They
Right.
might be, in their last few months. And who are we to say, no, I can fix you or whatever? No,
Right.
that's not how it works. If we're there just to hold their hand as they come to the realization, and I actually do have a situation like that with somebody I know right now. Hold their
Yeah.
hand in that until they come to the realization, like, oh, this is the next step. It's the ultimate surrender so that
Yeah.
I can transition to the other side and continue my soul's work on the other side. And
Exactly.
yeah, sometimes that's the work of the practitioners to hold their hand as they walk through. It's
Right.
humbling.
Oh, yeah. I mean, well, the word, and you are a humble, beautiful soul. And so I know just from working with you and from knowing you on many levels that the work you do is it's important, it's vital, but it's very beautiful because of who you are.
Thank you.
So,
Yeah,
I have so enjoyed this conversation. And again, it means a lot to me. And I want to thank you for your time because it is really important to me to let our listeners, all those professional humans out there, know what your options are and that there are many things out there for us. And sometimes we may use the same healing modalities or practices for many, many years and they work for us, or maybe our whole lives. And then other times they might work for a time and then we move on to something else, or what works for one person doesn't work for another. And again, maybe our path is to work with our own resistance to actually healing what we say we want to heal. And maybe we truly do. And maybe that is our soul's journey, but we have to get to the place of being willing and being open to it. So there's so much more than just the checking the boxes, one, two, three, and there we go. And we're off to, the next thing. But it is a really beautiful journey and it requires a lot of courage, a lot of patience with ourselves, and a lot of love for ourselves.
mhm, mhm.
So, and be looking in the coming months, probably beginning of January or February. I'll be starting a series on relationships. So, be looking because there could be another conversation and appearance from Mary and a couple of other characters in this in this professional human experience. So, and if you would like to know more about Mary's work, it's maryhisting.com, right?
That's correct. Just my
Website?
name. Hmm.
Yes. And you can find her on Instagram, Facebook, all the things.
Hmm.
If you want to reach out to her and schedule a session, whether remotely, you are in Northern Virginia. So for
Yes.
all my people in Northern Virginia, she's right there. You got her in person, you got her live. But if you want to talk with her about some remote healing sessions, then you know where to find her.
Hmm. Yes.
And thank you again, Mary, for being on the show and sharing your
Oh.
wisdom. And just thank you for being on the planet.
Thank you, Karen. It's always a pleasure.
We'll see you next time, folks.